I manage a pharmacy in Amsterdam, and last summer this American woman came in asking where the prescription drop-off was. I pointed to the counter right in front of her. She looked confused and said she needed to drop off her prescription so we could fill it while she waited at the hotel. I told her we'd fill it now. Takes maybe 5 minutes. She stared at me like I'd offered to perform surgery in the back room. You can't just make medication without my doctor calling it in and my insurance pre-approving it, she said. That's how people die from counterfeit pills. I showed her the prescription she was holding, explained that's literally all we needed, and she spent 10 minutes asking if our pharmacist was board certified and whether the EU had pharmacy laws. When I finally convinced her we could legally dispense medication she'd been prescribed, she asked if she needed to come back tomorrow to pick it up. The whole transaction took less time than her interrogation. My cousin works at a pharmacy in Oslo and had an American guy refuse to believe he could buy antihistamines without showing ID and signing a logbook. He kept insisting Norway must have a meth problem we were hiding, and that Sudafed was basically a controlled substance everywhere. Civilized. My cousin handed him a box of cetirizine. From the shelf behind the register, the American examined it like it might explode, then asked why it didn't have 17 warning labels and a child-proof cap that required engineering knowledge to open at a pharmacy in Lisbon. An American demanded to speak to the pharmacist's supervisor because she wouldn't accept his GoodRx coupon. He explained very slowly that GoodRx worked at any pharmacy in the world because it was international. The pharmacist tried to tell him she'd never heard of it and that his prescription cost €8 anyway. He pulled up the GoodRx website on his phone as proof of its existence, then got upset when she still wouldn't scan his coupon code. He paid the €8 while muttering about European inefficiency. I'm a clinic receptionist in Copenhagen, and this American came in for a scheduled appointment looking panicked. She asked where to check in and fill out her paperwork. I told her she was checked in, her doctor would call her in a moment. She insisted there must be forms about her medical history, current medications, insurance coverage, lease waivers, and privacy acknowledgments. I said her doctor would ask about relevant history during the appointment. She got agitated and said she needed to provide insurance information or she couldn't be seen. I explained we don't need insurance information. She pulled out a folder with her insurance card, passport, and previous medical records, saying she'd brought everything just in case. You can't see a doctor without verifying coverage first, she said. That's how people get surprise bills for thousands of dollars. I told her the appointment cost would be around 200 kroner, about $30, regardless of what the doctor did. She asked what the real bill would look like after insurance processing. I said that was the real bill. She sat down, but kept glancing at the folder, like she might need to present it as evidence at any moment. My brother manages a doctor's office in Melbourne. An American patient called 3 times. Before her appointment to confirm they had received her insurance pre-authorization for a routine physical exam. Each time he explained, Australia doesn't have pre-authorization for GP visits. She didn't believe him and said her insurance company required international providers to obtain approval codes. On the day of the appointment, she brought a printed letter from her insurance company explaining their international coverage process. My brother's receptionist tried to explain that the office doesn't bill international insurance companies and that she'd just pay the standard consultation fee. The American insisted this would create a coordination of benefits issue, and that she needed an itemized super bill with specific diagnosis codes. She ended up paying the $80 consultation fee but asked for a receipt with about 15 different data fields that don't exist in Australian medical billing. I work at a hospital in Vienna, and an American man in the emergency department asked to see our charge master before receiving treatment for a sprained ankle. He explained he needed to review the hospital's price list to understand what he'd be billed. I told him the visit would cost the standard emergency fee. He said that wasn't possible because different procedures have different costs, and he needed itemized pricing for the X-ray, the doctor's evaluation, any bandaging materials, and facility fees. I'm not signing a blank check, he said. That's how hospitals charge $40 for a single aspirin. I explained our pricing doesn't work that way and that he'd pay one fee, regardless of what treatment he received. He asked how we could possibly run a hospital without transparent pricing. I told him the total cost would be around €300. He asked what his patient responsibility would be after insurance. I said €300 was the total. He received treatment, but requested an itemized breakdown anyway, which our billing system literally cannot generate, because we don't itemize that way. My sister works registration at a health clinic in Stockholm. An American woman asked if the clinic was in network with Aetna. My sister had no idea what that meant. The American explained very patiently that she needed to verify the clinic participated in her insurance network, or she'd face out-of-network penalties. My sister said the clinic doesn't participate in American insurance networks because it's in Sweden. The American asked how Swedish people afford healthcare if nothing is in network. My sister tried to explain the Swedish healthcare system, but the American interrupted to say she'd researched international coverage and that major carriers have global networks. She called Aetna from the waiting room, spent 20 minutes on hold, and came back to report that Aetna would reimburse her for out-of-network international care if she submitted a claim with the right codes. She asked if my sister could ensure the doctor used CPT codes instead of whatever European coding system they normally used. My sister said she didn't know what CPT codes were. The American looked genuinely distressed and asked how Swedish people submit insurance claims. I'm a dentist in Brussels, and an American patient seemed confused during his cleaning when I told him we were done after 30 minutes. He asked when the dentist would come in to do the exam. I explained I was the dentist and I'd just completed his exam during the cleaning. He said his dentist in America always did a separate examination after the hygienist finished cleaning. I told him I don't employ a separate hygienist, I do the cleanings myself. He looked uncomfortable and asked if that was standard in Belgium. I said yes. Most dentists here do their own cleanings. He asked if I had the proper certifications for both dentistry and hygiene. I showed him my dental degree on the wall. He paid but mentioned he found it weird that I did the hygienist's job, and said in America that would be like a surgeon doing the nurse's work. I told him the visit cost €60. He asked if that was just for the cleaning or if the exam was separate. I said that was the total cost. He stared at his receipt for a long moment, then asked if Belgian dental care was less thorough than American dental care because it costs less. My uncle runs a optometry practice in Prague, and an American came in asking about getting contact lenses. My uncle examined his eyes and wrote a prescription. The American asked when he could schedule his fitting appointment. My uncle said he didn't need a separate fitting, the prescription was complete. The American insisted you can't get contacts without a fitting, where they teach you how to insert and remove them and verify the correct lens. My uncle told him he'd just order the contacts online or buy them at any optician. The American said that was illegal without a prescription being sent directly from the optometrist to the supplier. My uncle handed him the written prescription and said he could take it anywhere. The American photographed it and asked if he was allowed to use it to order lenses himself. My uncle said yes, that's how prescriptions work. The American seemed amazed that he could just buy contact lenses like a regular product, and said in America the optometrist has to send the prescription electronically to approved suppliers, and you can't just shop around. He asked if Czech opticians sold expired or counterfeit lenses since there was no verification system. I work at a physiotherapy clinic in Toronto, and an American asked how many sessions his insurance would approve. I said I didn't know anything about his insurance. He explained his insurance company pre-approved a specific number of physical therapy sessions, and he needed to know if I'd received the authorization. I told him we don't communicate with American insurance companies. He asked how I would bill his insurance if I didn't have his information. I said I wouldn't bill his insurance. He'd pay for each session and seek reimbursement himself if he wanted. He looked panicked and said he couldn't afford therapy without insurance coverage. I told him each session cost $70 Canadian. He went quiet, then asked how many sessions he'd need. I said probably 6 to 8 based on his injury. He did the math and seemed stunned that the total cost would be less than his insurance deductible in America. He asked if the lower cost meant Canadian physiotherapy was less advanced than American therapy. He booked 6 sessions, but said he felt like he was taking a risk paying out of pocket. My cousin is an optician in Dublin, and an American woman wanted to buy prescription sunglasses. My cousin asked for her prescription. She said she didn't have it with her, but could call her optometrist in Florida to have them fax it. My cousin said she could just do an eye exam right now if the prescription wasn't current. The American said she'd had an exam 4 months ago, so the prescription was fine. She just needed it transferred. My cousin offered to call the Florida optometrist's office and get the prescription details over the phone. The American seemed shocked and said her optometrist would never give out prescription information without a formal release authorization. My cousin called anyway, got the prescription in 2 minutes, and started preparing the sunglasses order. The American asked if what they'd just done was HIPAA compliant, and whether my cousin could legally obtain medical information without written consent. My cousin said Ireland doesn't have HIPAA. The American asked what privacy laws prevented opticians from stealing people's prescription information. My cousin said mostly just the part where nobody benefits from stealing eyeglass prescriptions. The American filled out a form anyway, documenting that she'd verbally consented to the information transfer, just for her own records. I teach at a university health center in Berlin, and an American exchange student came in requesting a referral to a specialist for her migraines. I asked if she'd like me to examine her first, or if she already knew which specialist she wanted. She said she needed a referral before she could book a specialist appointment. I told her she could book directly with any neurologist. She insisted her insurance required a primary care referral for specialist visits. I explained German insurance doesn't work that way, and that she could simply make an appointment. She said that couldn't be right because specialists cost more, and insurance companies control access through the referral system to prevent unnecessary specialist visits. That's basic health economics, she said. I suggested she just call a neurologist's office. She asked if I would at least write her a note recommending specialist care so she'd have documentation. I wrote a brief summary of her symptoms in case the neurologist wanted background. She asked if I'd included the referral authorization codes. I said there are no such codes in Germany. She took the note, but said she was worried the neurologist wouldn't see her without a proper referral. My friend works at a walk-in clinic in Auckland, and an American man asked what his copay was. She said she didn't know what that meant. He explained it was the fixed amount he paid per visit before insurance covered the rest. She told him the visit cost 60 New Zealand dollars. He asked what his responsibility would be after insurance processing. She said $60 was his responsibility. He asked if the clinic would bill his insurance for the remainder. She said the clinic doesn't bill American insurance. He seemed confused and asked how insurance worked if providers don't bill them. She tried to explain that he'd pay the full cost up front and could submit a claim to his insurance himself for potential reimbursement. He said that wasn't how insurance worked, and that providers always bill insurance companies directly because patients can't be trusted to file claims properly. She told him that's how it works in New Zealand for international patients. He paid the $60 but asked for a super bill with specific codes his insurance would recognize. She printed a standard receipt. He stared at it and said his insurance would reject it. Without proper diagnosis codes and tax identification numbers, I'm a nurse at a medical center in Lyon, and an American patient asked if we accepted HSA cards. I'd never heard of them. He explained it was a health savings account card that worked like a debit card for medical expenses. I said we accepted regular debit and credit cards. He said his HSA card was a special medical payment card that only worked for healthcare expenses and came with tax advantages. I told him to try running it as a regular debit card. It processed normally. He seemed surprised it worked and said French payment systems must be more flexible than American ones. He asked if the transaction would be coded correctly so his HSA administrator would recognize it as a qualified medical expense. I had no idea what he was talking about. He said if the merchant code wasn't right, the IRS might reject his tax deduction. I told him, we're a medical center, so presumably our payment system identifies us as such. He took a photo of the receipt and said he'd sort it out with his HSA administrator later, but that international healthcare created complicated tax reporting issues. My brother-in-law runs a pharmacy in Zurich, and an American asked if they could use their flexible spending account card. He said he didn't know what that was. She explained it was a pre-tax account for medical expenses that had to be used before the end of the year or the money disappeared. He said that sounded complicated, but we accepted all major cards. She tried her FSA card and it worked. She seemed relieved and said she'd been worried Swiss pharmacies wouldn't recognize American healthcare payment cards. She bought several items and Explained she was maximizing her FSA before it expired. Because American healthcare financing required careful planning to avoid leaving money on the table. He asked why her money would disappear if she didn't spend it. She said that was just how FSAs work to incentivize using healthcare services. He said that seemed like a strange way to structure healthcare payment. She agreed, but said it saved her about 30% on taxes, so it was worth the hassle of tracking eligible expenses and making sure to spend exactly the right amount each year. I work at a hospital billing office in Oslo. An American patient called 6 times over 2 weeks asking when she'd receive her bill. Each time I told her the bill had already been provided at discharge. She insisted that wasn't the real bill, just a preliminary estimate, and that the actual bill with insurance adjustments would come later. I explained she'd received the complete bill, and it was paid. She asked about additional bills from the radiologist, the lab, the anesthesiologist, and the hospital facility. I said all of that was included in the single bill she'd already paid. She seemed convinced separate bills would arrive eventually and said she'd set aside money in her budget for the surprise billing she'd heard about. I told her no other bills were coming. She said she'd call back in a month to confirm because in her experience, hospital bills kept arriving for up to 6 months after treatment. 3 months later, she called again, asking if we'd forgotten to bill her for something, because she still hadn't received any additional charges. I told her again that everything was complete. She said the whole experience had been stressful because she kept waiting for the other shoe to drop.